Welcome, everyone, to the Kidney Korner Podcast. I am your host, Craig Merritt. I'm also the founder and executive director of the Get in Position Foundation. Our motto is make sure you get in position as it relates to your health. I am so excited about this particular episode and our very special guest today, who happens to be my post-transplant nephrologist. So you guys got to know I'm bubbling inside. I'm so excited, and I'm so grateful at the same time to have her. I've been wanting someone from my post-transplant team to be a guest here on the Kidney Korner Podcast, and also to our podcast is from a patient perspective. Okay. One of our disclaimers is I am not a healthcare professional. However, I am an experienced professional because I lived through it. But today, folks, we have a healthcare professional. So let's get into it. I'll introduce her. Dr. Aurora Salas is a professor of medicine and transplant nephrologist at the Medical University of South Carolina. Woo, woo, my transplant facility. And Ralph Johnson VA. She also serves as the Transplant Nephrology Fellowship Program Director and Pancreas Transplant Medical Director. Dr. Salas completed her medical degree at the University of the Philippines. She pursued internal medicine residency at the University of Connecticut. Go UConn. General Nephrology Fellowship at Northwestern University and Transplant Nephrology Fellowship at the Medical University of South Carolina. Dr. Salas's research interests are outcomes of kidney and pancreas transplant recipients, as well as living donors. Wow, we got to bring her back on the living donor side, so look out for that. Dr. Salas she currently resides in Charleston, South Carolina, with her husband and 4 children. She enjoys cooking and traveling. Ladies and gentlemen, without further ado, my post-transplant nephrologist, Dr. Salas. Dr. Salas, welcome.
Good morning, Craig. Good morning, everyone.
Good morning. How are you today?
I'm feeling good. Thank you so much for asking. I hope you're doing
Yes,
well.
I am doing well. And on our appointment, we'll go over how well I'm doing with
True.
the numbers. We'll talk about that at my appointment. We won't get into that on the podcast. So again, welcome. And I am so excited to have someone from my post-transplant team at MUSC. As you can see, I keep you guys over my shoulder
I
back
see
there.
that.
And one of the things I will say about MUSC, when I was a dialysis patient and seeking transplant and the going through the evaluation process, I will say, and hear me out, Dr. Salas, hear me out. MUSC, I was listed at 3 transplant facilities: Emory University here in Atlanta, UAB, University of Birmingham, Alabama, MUSC, and I was working on my 4th at Atrium Health in Charlotte, North Carolina. Out of those 4 or 3, MUSC was not on my top priority.
Okay.
I had a little bit of an experience. It wasn't quite pleasant at first. And in my mind, I was like, no, I don't think MUSC is for me. However, you guys called first. I got the call from you guys first. And I must say, I've had the best experience, hospital experience of my life ever.
That's
The
good to hear.
care, yes, the care, the process, the education, the attention to detail was immaculate and impeccable. Those are the two words I could use, and I brag about you guys all of the time. I can't express enough what MUSC has meant to me and my family
Thank
and my
you.
post
Thank you.
transplant. Yes, yes. Could you kind of describe to me or our audience, because I'm very biased, folks. Hey, if you if you're seeking a transplant facility, MUSC Charleston, I I'm very biased now. Could you describe to me first and foremost? We're going to get into the evaluation process, but I need to know, what is that culture like there at MUSC?
All right. So I think we have to speak about the culture. We also have to speak about what MUSC transplant is truly all about, right? So in my professional journey, I've seen patients who get diagnosed with kidney disease, who get told that they need to be on dialysis. And I've served those patients, rounded on those patients in dialysis. And I see that they're not very happy in dialysis. It takes a lot off of their health, right?
Mm-hmm.
In the end, to be spending hours hooked to a machine, whether it be hemodialysis or peritoneal dialysis, really it takes a toll on the patient, not only on their health, but also on their personal lives. That's time taken away from them to get their treatment, of course, which is life saving at that point, but also takes them away from their studies, their work, their family time. And so that's what really inspired me to look at the other side of kidney treatment, which is kidney transplant. And again, in my early career, getting the chance to work with transplant patients who are finally so happy that they don't have to be on dialysis. And they're like, what am I going to do with all this time? I don't
Right.
have to go to dialysis anymore for several hours each day and several times a week or nightly on PD, hooked to the machine. Now I can go back to my studies that I deferred. Now I can go back to work. If they were part-time, now they're picking up full-time work again. Now they're able to attend family gatherings more freely and able to see family who are, far away from them. It was such a joy for them. And what I thought in my mind is like, I want to be part of that joyful journey, and how can I make that happen in my career? And so
Mhm.
that's what I decided that besides doing general nephrology, I really do want to pursue transplant nephrology to be part of that joyful journey with the patient. And so that's when I trained at the Medical University of South Carolina. I've been with the program since 2011. So it speaks of, the relationship I've also formed with the institution. And to your point, I think MUSC treat each patient like family, We always, at the end of the day, yes, we have the protocols, we have our clinical operations, but at the end of the day, our bottom line is like, treat your patient like they're your family. Like,
Yeah.
advise them as if they were your brother, your sister, your mom, your dad. Would you advise it if they were related to you? Will you do something if they were related to you? And I think that helped to form that bottom line culture. Same way as you said, how you would treat them while they're admitted in the hospital, still recovering from their surgery, while they're still so overwhelmed with a lot of medication changes, right? Coming out of
Yeah.
transplant,
Yes.
navigating that life, transitioning from chronic kidney disease or dialysis life to transplant life. What's that adjustment gonna look like, and making sure that they know they're not alone in the process, right? Gathering rallying their family, their friends, their caregiver support around them, and knowing that the patient and their caregivers have support available with the transplant center. As you know, we always have 24/7 support for our patients
Yes.
because we want to get you to a point where you're not only transplanted, but we're keeping that kidney transplant healthy and the patient healthy and doing well for as long as possible. And that is our commitment with each and every kidney transplant patient that we take care of.
Awesome. Yes. And I am a witness to all of this. Not only that you all in the culture of MUSC, you all treat your patients as family. I could attest to that. One of the things too is your process post transplant is completely different. I had a good friend of mine. We went through the same issues, being on dialysis, all of the same things at the same time. He actually received his transplant 1 month after I did, and he lives down in Florida. And so I won't say the name of the hospital there. However, I was trying to compare because we were just, recently transplanted, trying to figure this thing out, trying to get back on our feet, trying to heal. And I'm asking him, okay, did they do this? And he's like, no. I said, okay, so did they give you a booklet with what you needed to do? And no, he's like, no. I said, okay, did they have a personal nurse assigned to you? He was like, no. I was like, really? So, I'm thinking all transplant facilities are doing the same thing, and I learned and discovered they are not. They are not, and that's why I feel as though uh, myself and my family, we were very fortunate to have you guys as our transplant facility. So thank you, and thank MUSC, all of the staff over there who work in transplant, that whole department, great, from the nurses assistants, everybody. So thank you guys. Doing an awesome job. So Dr. Salas, let's get into this whole evaluation process. Um, I will ask the same questions that I asked Zachary Sutton, who I had on earlier this week. We talked about the same process. I'll ask you the same questions. What is this process, and why do we have it? What is the need for it? What is it?
All right. So basically, when somebody has chronic kidney disease, right, the thought process is the kidney function will deteriorate over time.
Mm-hmm.
And so at a certain point, particularly when somebody's kidney function or their glomerular filtration rate or GFR falls close to about 20 mLs per minute, or percent is what we call it, right? 20% kidney function. We really have to prepare the patients for what are their options, to deal with this chronic kidney disease. And a lot of times when they're working with their nephrologist, they're going to be educated on what dialysis modalities are available for them and what will be the most acceptable for them. But at the same time, more and more now in kidney medicine, we are learning that as we're educating our patients about dialysis, we also have to educate them that transplant is an
Mm-hmm.
option. And in fact, if somebody could get transplanted even before they need to be on dialysis, that would be the most ideal situation, right? But of course, there's a process, as you know, to get there. So that I always tell my patients, look, if transplant is not quite ready for you and you are ready for dialysis, it's okay. You have to go through dialysis as your nephrologist advises, and then let's work on your transplant. So, like I'd said earlier, dialysis and transplant are your two options for treatment of kidney disease. Um, but we know from decades of studies now that transplant is more superior in the sense that it allows the patients to live longer. That's really the
Mhm.
most important benefit that we get from a kidney transplant. Plus, all
Yes.
the other health and lifestyle benefits that it brings, when somebody is no longer needing to be on dialysis. Um, and so we always want to make sure that every patient who has advanced chronic kidney disease, approaching end stage kidney disease, or on dialysis for that matter, has a chance to be evaluated for kidney transplant.
Okay. Okay. All right. So as we talk about this whole process being evaluated, you would think, and again, the Kidney Corner podcast is from a patient perspective. So we're thinking from the minds of patients, right? Who who are in desperate need of this option, this treatment option of transplant. Some people think because these are the questions that I ran into while I was seeking out evaluation. People tend to think because you have kidney failure and you're in need of a transplant, why don't they just give you the transplant or the kidney anyway? Why do I have to go through all of this questions and appointments and this, that, and the other? I need one. I want one. Dialysis sucks. I hate it. Give me a kidney. Why I got to go through this?
That's a very good question. And that brings us to like what nationally is the condition of chronic kidney disease and transplant, right? Right now, there's over 100,000 patients on the kidney transplant wait list. And every year, about 20 to 25,000 kidney transplants are performed. But at the same time, more and more patients are added to that wait list. So if you do the math, there's definitely a shortage of organs compared to people needing a kidney transplant. So, to your point, if somebody says, I need a kidney, so does, you know,
All of those other people.
99,000 other people, right? And so that's where we're looking at saying that we do have a process to get there. We do have a system to you know, give the kidneys
Mm-hmm.
to the patients based on the merits of their health as well as their status on the wait list. So, for lack of a better term, we have to ration the organs, right? Because of the shortage of organ transplants. And it brings us to like bigger um, systemic issues that we need to be working on, that is increasing organ donation, not only deceased
Right.
donor, the cadaver kidney donors, but also
Right.
the living donors, because we're really always looking to bridge that gap in terms of like the organ supply and the number of people that are really needing the organ transplant.
Okay. Okay. So what do you if I need one, what are you looking for?
All
What
right.
during these evaluations? What why all these tests? Why these questions? I need one. You know I need one. What is that about?
All right. So, as you said, this is like eligibility for kidney transplant, right? Of course, first and foremost, we need to establish that kidney disease is at the level of needing a kidney transplant. Like I've mentioned earlier, your kidney function has to be about 20% or lower, or you're needing dialysis for a protracted period of time to be eligible for the kidney transplant. We also want to make sure that if you receive your kidney transplant, that you can keep that kidney transplant healthy and going for a good while, right?
Mhm.
So if we are lining up people to receive a kidney transplant, we want to make sure that that organ really is utilized to the very best potential it can. And so, what it entails is we need to really evaluate thoroughly, screen our potential recipients to make sure that they can keep this kidney going, that they can keep their bodies healthy, so
Mhm.
that we can get this valuable resource, the organ transplant, to
Right.
stay healthy in their bodies for a very, very long time. Because what does that
Absolutely.
mean? That you're pulling from, a pool that is needed by 100,000 other people.
Absolutely. And like Dr. Salas, I knew the answer to that. But it's for our audience because I get it all the time because now through the Get in Position Foundation and I mentor individuals who are seeking the transplant option, treatment option, going on evaluations. We go on evaluations with them. And so many people who are in this position really don't understand, first and foremost, to your point, there's so many other people in line. And the most important thing I think that we fail to realize, and I understand it because I was a patient, I was there. Because all I could think about was me, right? I can't think about the other 100,000. I think about me and how I feel right now. But at the same time, we don't have an understanding that number one, that kidney organ is the number one most transplanted organ on the planet, right? So that's outside of the US, UK, wherever, Africa, wherever on the planet. And there is a shortage, right? So from your perspective as a nephrologist, as a doctor, you guys don't want to see that organ that's so vital, right? And precious because we don't have many of them going to waste, going to waste. Speak about how and this is during the process, the evaluation process. What are those key things that you all look for that makes someone a good candidate or eligible candidate for transplant?
All right. So, whenever I see a patient for kidney transplant evaluation, I simplify my requirements to four things. Okay. And I'll speak of those four things because I ask myself these questions whenever I see a kidney transplant patient. The first is that, will my patient survive the kidney transplant surgery?
Wow.
Okay. That's the first thing, right? Is they have to first survive the surgery. So, what does that entail? I want to make sure that their heart, their lungs are strong for the surgery. I want to make sure that any other medical conditions they have are adequately controlled, addressed, and stable, right? To make sure that we can safely make it through the kidney transplant surgery, which, as you know, is quite extensive, right? The
Mhm.
surgery in itself takes about 3 to 4 hours, which means that the patient will be under general anesthesia during that period of time. And so it's
Right.
a very crucial period in the transplant where I want to make sure that the patient can make it through, right? And
Yes.
unfortunately, there are certain things that we need to be looking at for that. If somebody has heart disease that need to first be addressed, if somebody has severe lung disease that need to be addressed, these are some of the things that we need to be focusing on before we say, okay, you can go through surgery, right? So that's foremost. That's the first one.
Hmm.
The next thing I ask myself is, okay, if my patient makes it through surgery, will they have a good recovery after the transplant? Okay.
Ah,
It doesn't end in just putting the kidney inside your body. Now it's time to, make it work, not just the kidney, but the whole body, right? And I tell my patients, my biggest predictor of your recovery after the transplant is how you're doing before the transplant. Have
mm,
living an active lifestyle, meaning despite dialysis or despite your kidney disease, are you at least putting in time to exercise, to walk, to do your chores at home? Very, very important, right? Or are you spending most of your time in bed or on the couch and barely doing anything? it really makes a big difference in how I evaluate as well as in how I counsel my patients. Because this is not only unique to kidney transplant surgery, this is true for all surgeries, that if you can get up soon after any kind of surgery, you will have better recovery and better outcome after your surgery. And the time to prepare for that is not during the surgery or immediately after, it's way ahead of time.
Yeah, yeah,
you
yeah.
put in you put in the effort to strengthen your body, to engage in some degree of exercise. Nothing heroic, right? We're not asking you to run a marathon or
Right.
whatnot, but at least have that certain degree of activity where you know that following, your kidney transplant surgery, you can get out of that bed, you can walk, and you can be ambulatory and mobile. So it's very, very important. I tell my patients, walk 30 minutes every day. Don't be afraid to do chores. Don't be afraid to help around the house. Don't be afraid to go out, the house and walk. If you need a cane, if you need a walker, for as long as you're exerting yourself, putting in some time to exercise, that's better than nothing, right? I
Yes, yes.
if you walk a block today and it takes you 30 minutes to get through that block, it's okay. Know that
Mhm.
tomorrow you come out again. Maybe you can cover 1.5, 2 blocks until you find yourself walking more and more, longer distances and longer time. So it's a process. And that's why I tell my patients, prepare now while you're being evaluated for the kidney transplant, because this is coming in the future. We're going to be asking this of you, to be ambulating, to be walking, right? To be
Right.
yourself somehow, right?
Dr. Salas, I appreciate you so much because you just confirm one of the things that we teach our mentees uh, is is that you have to train for the surgery. You have to be in shape
True.
for the surgery. And I guess for us, when we hear that word get in shape, we think of the Rocky movie, right? Training. Dun, 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 dun. No, because you're on dialysis and we know you don't feel well anyway. You're drained and so on and so forth. We're not saying go to the Gold's Gym and lift all of this weight, but be active because this surgery is intense. This is a very intense surgery. And to your point, thank you so much for saying this. And this will be one of the highlights of this podcast episode is that, and to all of my dialysis patients, kidney patients that are seeking a transplant, please hear what Dr. Salas has stated, that they want to make sure your heart is strong, your lungs are strong, because you have to make it through. What sense is it? If you come on, we want you to live. We want you to have a healthy, prosperous life. This is the reason why you're going this route for this form of treatment. Am I correct?
Correct. Yeah.
Yeah. We have to move. We have to prepare uh, uh, for the surgery first and foremost. First and foremost. So now let's talk about, once a person has prepared, they have the surgery. Now, in the evaluation process, there are a few questions and things that I know that the evaluation transplant team is looking after or seeking after. Um, the after we come out of surgery,
Right.
what
And
what
that
are we looking?
constitute yeah, that constitute my third and fourth questions to myself and to the patient, right? As you said, going through surgery and having that immediate post operative recovery is one thing, Now it's like facing the life of a transplant recipient, right? And what I always tell my patients is part of being a kidney transplant recipient is the commitment to take your anti-rejection medications, right? Because whenever you borrow an organ from some other person, whether that person was a cadaver deceased donor or a living donor, right? That kidney does not belong to you. It's different from your body's constitution. And
Mm.
so if we put that kidney inside your body, your immune cells are going to learn, hey, this is not mine. This is not my organ. And what will your immune system naturally want to do? It will want to reject or attack that organ.
My name is Joshua Albright.
I'm Kimberly Queen, and you're watching the Kidney Korner Podcast.
So we learned that from early experiences in transplant, like way decades ago. And so now in transplant medicine, we know that part of being a kidney transplant recipient is the commitment to be maintained on these anti-rejection medications, because these medications will help to prevent the rejection of your organ.
Mhm.
Now, how does that work? The way it works is that this anti-rejection medications will suppress the person's immune system so that it
Right.
doesn't go attacking, rejecting the organ, right?
Mhm.
Sounds scary. It's true because
Yeah.
whenever we deal with medications that suppress the immune system, the biggest risk downside would be increased risk of infections and cancers. Those might be the biggest things that I always mention to my patients. Now, it
Mhm.
doesn't mean that if you're on anti-rejection medications that you will automatically develop these things, right? But it does increase your risk quite a bit when you're on anti-rejection medications compared to people who are not on anti-rejection medications.
Right.
So then what am I looking for now is to make sure that the patient doesn't have any active infections that can get worse when we start them on these anti-rejection medications, or if they have any infections that they first be treated for them, right? And
Mhm.
then that they don't have any active cancers or malignancies, or if they ever do, they at least should be treated for those first before they come back around for kidney transplant. Okay.
Okay.
Now, not all infections and cancers are the same, right? It goes in a spectrum of very mild to very severe. And this is where the individualized consideration of each person's case comes into play, is that we have to really work with the patient and the physicians taking care of them for their infection or for their cancer, right? To work
Mhm.
out a plan. What does the patient need to be treated? Okay. What kind of infection, cancer is this, and how severe? And then ultimately, what we want to know is there going to be a period in this patient's time or health that we can safely give them the anti-rejection medications. And that's probably the best time for them to be thinking about the kidney transplant. So again, because of the spectrum of severity of infections and cancers, there's not what blanket case to say yes or no.
Right.
It's
Okay.
always like it's dependent on the individual case, like, of the merits of what their health condition was. But basically, that's what we're looking at. And for people who don't have any active infections or active malignancy, the basic things we screen for infections. Most of them is through your blood work when you come in for your transplant evaluation. And then also for cancer screening, right? For everybody, some kind of colon cancer screening, whether that be a colonoscopy, a stool exam, or imaging, right? For men, screening for prostate cancer. For women, screening for breast cancer and um, cervical cancer through their pap smear.
Mhm.
And then for smokers, screening for lung cancer. Those are some of the things that we would screen for to ensure that a person is free of any kind of cancer. And of course, the advice to get rid of things that can increase your risk of cancer. And to me, the biggest thing is smoking. smoking cigarettes or any kind of nicotine product exposure really would increase the risk for cancers. I counsel my patients about the merits of quitting smoking or nicotine products. Again, not because we want to punish the patients, right?
Right, right.
But again, we're preparing them for something bigger, you know, that is their kidney transplant surgery and then being able to receive these anti-rejection medications.
Right, because and let's explain it just a little bit about those medications and what they actually do. You went over it, but I think we need to say it again because most people don't really understand what's happening to their immune system. So those medications again, just briefly go over what those medications actually do and why it's such a big risk.
So as I said, these anti-rejection medications, they suppress your immune system, right? Everybody has their immune system, and the immune system, we naturally use that to fight germs, to fight bacteria, to fight viruses, right? It's the immune system that you wake up when you receive a vaccine because you want to strengthen your immunity. So that immune system is at the core of your response to infections. That's how you fight infections, right? Same for cancers. It's your immune system that might pick up this little, beginning cancer cells and try to suppress it. So that's the role of our immune system to our bodies, right?
Mhm.
So left alone, it will function like it should, right? But at the same time, like we said, if we let it function as it should, and there's a kidney transplant inside your body that's foreign to you, that's not yours, then the immune system's natural response to that is let's fight it, let's take it
Mhm.
out, let's take it down, right? Because it doesn't belong here, it's foreign, it's not ours, it has to be rejected or attacked somehow, right? But we don't want to do that. We want to do that for germs. We want to do that for cancer cells, sure. But we don't want to do that for an organ transplant that we put inside, a recipient's body. And so, yes, there has to be a trade off that we have to now suppress the immune system of that patient. And the effect is universal. Our goal when we're doing this immunosuppression, when we're giving you your anti-rejection medications, is to, of course, prevent rejecting the kidney transplant, allow it to flourish inside your body, even though it doesn't belong to you, allow it to be tolerated by your body and not be rejected. Those are all the benefits that go along with taking the anti-rejection medications. But as I said, in the midst of us suppressing the immune system to allow for your organ transplant to flourish, we're also suppressing the same immune system that helps you fight infections and cancer cells.
Right.
And so that's that trade-off. That's that balance where, okay, I don't want you to reject your organ, but of course, I don't want you to develop infections and cancers as well. So that's why
Right.
it's finding that happy balance. Where is that balance? It varies from patient to patient. Where I'm happily seeing your kidney transplant flourishing without any risk of rejection, but we're also trying to avoid or minimize the risks of infections and cancers. So it's
Right.
really, you're right. It's a very serious business whenever
It
somebody is on anti-rejection immunosuppressive medications.
Yes, and the reason why I wanted you to reiterate that point is because some individuals may have the mindset that, boy, once I get this transplant, life is going to be smooth. I can go back to doing what I used to do. And some may even be a little laxed in taking their medications.
Mm-hmm.
And that's a problem.
It is a problem.
That's a huge problem. And if anyone who's listening and watching this podcast and says, yes, I really want and need a kidney transplant, yes, you have to prepare for the surgery. There's work that you have to do prior to receiving the transplant, but the work really begins after. It's post. It's post. And if you had problems taking your blood pressure medicines before, I don't know. I myself, again, I'm not a healthcare professional. I'm not your doctor, but I would say, I don't know if you're inconsistent with what you're doing today, I'm not sure that would make you uh, a good candidate. So you have to make some adjustments to your lifestyle. It's a lifestyle, folks. This is a lifestyle. You mentioned something, and this is what Zach Sutton he asked me to ask you regarding vaccines. Now, I know that there are individuals who are against certain vaccines while they're on dialysis. I'll be honest with you, I do not take the flu vaccine. I refuse it. I do every time. I do. I've always done it. Now there was one vaccine that I did accept, and that was the pneumonia one when I was on dialysis. But that flu, we're not going to get into it, but let's just talk about the vaccines. And of course, we've come through a pandemic, this whole COVID-19 thing, vaccines, and we do have individuals, which is their right.
Mhm.
And as patients, we have rights. As patients, we can accept, we can refuse, so on and so forth. But Dr. Salas, talk about those vaccines. And I know that many transplant facilities want to see certain vaccines on your chart. So just talk about that just for a second.
Right. So again, this is, an offshoot when we're anticipating that the patient will receive anti-rejection immunosuppressive medications after their kidney transplant. We want to prepare them ahead of time. If we already know that there could be an increased risk of infections because of these anti-rejection medications, we want to prepare them ahead of time. Okay. And so when you talk about infections, how do you prevent infections? One of the strategies we've had for decades now is to offer immunizations or vaccines, right? Because there are now a lot of infections that can be prevented with vaccines. And so these are available to our patients, and not only in transplant, right? The moment patients start dialysis, they are being offered all these vaccines for the same reasons that patients with chronic kidney disease are already considered immunocompromised to begin with. Their immune system is not as strong, even more so when they start to take these anti-rejection medications, right? And so again, when you talk about preparing for transplant, we want to set them up for the best possible outcome. We want to prepare them as much as we can. And part of that is mitigating that risk for infection. And part of that strategy is, yes, recommending that they get age appropriate and risk appropriate vaccines, right? Um, and there's a lot of them, as you said. There's pneumonia vaccine, shingles vaccine,
Yeah,
hepatitis B vaccine,
yeah.
right? The flu is an annual thing. So we do recommend it. COVID, I think it's good to be vaccinated. And I can tell you, when patients tell me I really hate the vaccines, and I'm like, well, I'm not a big fan of vaccines too. I mean, it hurts, right? It's natural for somebody to not want vaccines. But when I'm in the hospital and I see my patients suffer through a pneumonia because of flu, or
Mhm.
us losing patients because of a severe case of COVID,
Mhm.
then it makes you wonder, I wish the patient had a little bit more protection. and I wish the patient had the vaccine. Maybe that would have made a difference. I had a patient, or I still have him. I have a patient who, for the longest time, was refusing the flu vaccine. And just as you said, patients have the freedom. As your physicians, we are here to just offer advice, to give you our opinion about certain things. It's still up
Right.
to you, the patients, to decide, I'm going to take my doctor's advice, or I don't want to take my doctor's advice, right? That is your freedom. That is your leeway. But so I have this patient, for the longest time, he didn't want to receive the flu vaccine either, until we saw each other in the hospital. He was in the ICU, comatose, and in a mechanical ventilator. And it was a bad case of pneumonia because of the flu. And he fought hard for weeks and weeks in the ICU, finally recovered, had to go through physical therapy
Wow.
because he was very, very weak from that, intensive care admission, from that hospitalization. He almost had to learn to walk again and to live
Right.
again.
Right.
And I can tell you that first follow up after his hospital discharge, he said, Dr. Salas, the moment that flu vaccine is available, I'm going to be the first in line, lining up there and offering my arm for them to inject me. He said,
Mm,
never again will I want to get through that same experience. And
yeah.
I mean, watching him, we almost lost him. I totally say, yeah, that is a good insight. There are benefits to the vaccine. I understand that some patients have, maybe some adverse reaction or not so positive response to the vaccines. But whenever I see the other end of the spectrum of my patients who could have benefited from the vaccine, it makes me go back to that. It makes me, wish that the patients were open to those vaccines, because you just never know when an infection can hit hard, and you just never know when the vaccine could have made a difference, right? So for
Right.
those patients who had such severe infections, it was life changing for them, and it was, a commitment to say never again, right? Now, of course, we always, say to our patients, we don't wish you to be in that particular situation, but having been in this profession for a good while now, I can say that I have seen, a good bit of the bad side of it, the bad side of a patient who's unprotected,
Mhm.
unvaccinated, who went on to suffer really from a severe infection, which, again, you start to wonder, would it have made a difference if they were vaccinated? Maybe it would have, right? Science
Yeah.
tells us it could have. So
Yeah.
again,
I'm
that
pretty sure you've seen it. All types of stuff on the spectrum, all types of stuff. I'm pretty sure you've seen it. So now, Dr. Salas, we have asked some of our audience members, through our platforms on TikTok, Instagram, to provide us with some questions. And one question comes from Marceau on TikTok. She's new to dialysis, and she wanted to know that her transplant facility, I'm not sure which facility, where she's located, they want to do blood work and or classes. And she knows, because she's been told, that it could take up to 3 to 5 years to receive a transplant. So she wanted to know, does she have to keep going back and forth to the transplant facility again, folks? Not all transplant facilities are created equal. But her
Mhm.
question was, does she have to keep going back and forth to her transplant facility for blood work, number one, and for the classes?
Right. And as you'd already said, right, each transplant center has their unique set of plans, pre-transplant plans for the patient. And they do that because of certain reasons that, their center probably has found that this is the best way for the patients to be monitored closely, right?
Yeah.
I can tell you that the blood work that somebody has while they're on the wait list, that happens once a month for some transplant centers. Here at MUSC, that's once a quarter. So that's always a given that you have to give your blood. That's mostly for purposes of making sure that we can use that blood to match you should an organ offer come along, right? So that's what that's used for. But then the annual blood work is also used to screen for infections, because in a year things can happen, right? Your infection status can change. So we also screen for that. So I bet you that's probably what those yearly labs are for, is to make sure that she has ongoing monitoring um, of her infectious situation, right? And then the education, as you had said, I think all of us realize that one education session is not enough for everything to sink in and be absorbed.
Right.
And if it means having to go back to the center every year to have a refresher of the education, the information that they already get or already received, just to ensure that should the time come that they'll be called for their organ transplant, everything is solidified in their
Right.
minds, what to expect, what to do, how to approach things. Then I think, again, I would comply with that. From the standpoint of a transplant physician, most of the things we ask of our patients is because we really want our patients to be successful from the get go. We want them to be well equipped during the time of their transplant and to be fully aware, because awareness brings about a certain pattern of behavior and compliance. Like you
Mhm.
had said, right? If the patients are aware of the why, if the patients know the why behind the things that we advise, we find that we get more buy-in in terms of their compliance. Like if I tell them what their anti-rejection medications are doing for them, why it's important that they take it, right? Then I see the patient suddenly say, yeah, I think that's important that I don't miss any medications because I don't want to reject my organ and go back to dialysis.
Right.
Whenever I'm with the patient and their phone is going off because it's time for their medication, they're setting alarms. I'm, inwardly proud of them because they've translated that information into a pattern of behavior that
Yes.
allows them to be successful. And so
Mhm.
that to me is a very important part of why we educate, re-educate, and do it again, right? Because the hope is that as we, give you all the information that you need, you will then create that sense of commitment and insight to say, okay, then this is how I'm going to behave for my transplant and afterwards. This is, as you said, the lifestyle that I'm going to have to adapt now that I'm a kidney transplant recipient. And I can tell you, people who pay attention to what they learn in those transplant education bring it with them, bring it to their behavior after the transplant. And bottom line, we want our patients to be successful, and we will do anything within our resources to help make that happen. So I
Yes.
would say to your friend, who posted that question, that take advantage of that, because I bet you your transplant center is really just invested in your success. They want you to be well prepared. So don't think of it as an annoying thing. Think of it as your preparation towards something bigger and towards your success in transplant.
Absolutely. That's awesome. And I don't know where they're located. If they're located anywhere near South Carolina, please check out
Check us out.
MUSC. Yes, absolutely. We have another question from MD Naj. If you are a diabetic, can you apply for a kidney transplant?
That's a very interesting question. And I think the short answer is yes. Because diabetes, hypertension are actually the two most common causes of kidney disease, right? So, goes
Yes.
without saying, a big catchment of the patients that we evaluate for kidney transplant actually do have a history of diabetes. Now, just like in any kind of disease, diabetes can be a spectrum, right? So, there are certain things that we look at, right? Okay, you're a diabetic, you have that history, but how long have you been a diabetic? How are you doing with your blood sugar control? What are the end organ damage that the diabetes has done for you? And in the midst of all that, like we talked about, can we still make it through transplant safely? Can you still recover from the transplant? Can you still tolerate anti-rejection medications? So honestly, the diagnosis of diabetes per se, does not disqualify you for transplant. In fact, a lot of our patients have a background history of diabetes. It's really how you're doing with that diabetes, and definitely encourage good blood sugar control, before the transplant, even more so after the transplant. Because if you have that, that's already one step to say you're going to be eligible.
Okay, great. I'm glad you mentioned that about the majority of your patients are diabetics. Now, what is the approach? I had a question, a follow-up question to that. What is the approach to those patients who are diabetic? And as we know that some of the post-transplant immunosuppressant medication can raise your blood sugar levels. So as a doctor, a nephrologist, what is the approach when we know these things? Do we just give everybody the same thing or prescribe the same thing, or are we careful? Do we say no, not them two together? Uh, do we have the alternate choice or whatever? What happens?
What happens? Okay, so as I said, pre-transplant, we always want to make sure that they're already in good control of their diabetes, right? I mean, some patients come to us, they have this, we called it the hemoglobin A1C. That's the measure of
Yes.
their control, like their longer term control of their diabetes, right? And ideal would be around 6, 7%, right? We have some patients come in with A1C of like 11, 13, 15. So the diabetes has probably been so uncontrolled for a good while.
Yes.
And so those are the patients where, look, if you're looking for a kidney transplant, you gotta get back to your physician, your diabetes physician, your endocrinologist to work on better blood sugar control. Because as you'd already said, right, it's probably only gonna be bound to be challenged even more so once you start
Yes.
taking with anti-rejection medications, which some of them can increase your blood sugar. So if you're coming from a place where your blood sugar is already uncontrolled to begin with, then that's a recipe for disaster, right? So that's why we tell our diabetic patients, please take good control of your blood sugars, your diabetes, even before the transplant, right?
Mhm.
Now, post transplant, what are some of the measures that we do? Thankfully, we have strong partnerships with our diabetes team, our endocrinologists. So they work hand in hand with us from the get go, from day zero of the transplant. They're with us following these patients, anticipating these potential increases in their blood sugar, allowing for adjustments in their medications, their insulin for that matter, to anticipate these blood sugar surges that can happen as we're introducing these anti-rejection medications. And they get this longitudinal follow-up closely over a period of a few months, until their blood sugars are better controlled, they're on a stable regimen, and then we can then again share their care with their primary care physician or their local endocrinologist. So there is a pathway if you're asking me how we treat our diabetic patients.
Yes.
So there is a pathway, there's a system in place, there are support physicians that who work with us, in caring for our diabetic patients.
That's great. That is good to know. All right. These last few questions are from one of my mentees of the Get in Position Foundation. Marvina asks, once transplanted, will my numbers start going down immediately or will it take some time?
That's a very good question, Marvina. And that's where I am able to introduce like different kinds of kidney transplants, right? So let's start with like if you received your kidney from a living donor, the usual pattern is that your kidney numbers get better almost instantaneously, almost immediately. Some of the surgeons would tell us, okay, as I'm putting in that kidney, it's already making urine. That's how fast these kidneys work because they're from living donors, good quality kidneys, right? And we know that these kidneys tend to work almost immediately as compared to kidneys that are coming from cadaver or deceased donors, right? I tell my patients, picture it this way. The kidney went through death with the original owner of the kidney, right? The donor went through death. Same with the organ. It went through death before it got procured and transferred to your body. So it's up to your body to now bring this kidney back to life, right? So what does that process look like? So that entails that about 25 to 30% of cases, the kidney might be delayed in function, in which case, your numbers might not get better immediately after the transplant, okay? Or it might be even a time where the numbers are not getting better and we might have to support you with some dialysis after your transplant until such a time that the kidney opens up, okay? So that's in about 25 to 30% of this deceased donor kidneys. The other 70%, we hope, will work immediately, where you're making good amounts of urine as we're doing your daily blood work after your surgery, that we're seeing those numbers get better. So, and that's also the reason why we monitor you very closely immediately after the transplant to really determine how is your kidney doing and how can we support you in that immediate post-transplant period, depending on how your kidney is doing.
Awesome. She also asked, what is the time frame to getting to the hospital once you receive a call?
That's a good question. I get asked that question all the time. So, yes, it's almost like you're on call for your organ, right? So when you match for a certain organ, you actually have quite a bit of notice. I've asked my organ coordinators about this, and it takes about maybe 10 to 20 phone calls back and forth as an organ offer is progressing. Okay, so in that period of time, everybody is given a good amount of time to prepare. Okay, the first call that you're gonna get is probably just to say, hey, we have an organ who's a match for you. Okay, it's possible that by the time you're getting the call, that the organ is still inside the body of the donor. It hasn't been procured yet. That's possible. Or it's possible that the organ has already been procured, but it's still making its way from wherever it is coming from in the country, right? So that also parallels the time that we ask for our patients to be heading down to Charleston. So
Okay.
doesn't mean that when you get that call, you have to like drop everything and go, right? It's not like that. You get plenty of notice. You probably have a few hours to get your affairs in order, pack up, alert your caregivers, your drivers, right? You make sure you have childcare, make sure you have pet care, arrange everything in the home so that you're okay to leave it safely for a good while. So you have that time. And our coordinators are very helpful in helping you determine the timeline, because again, with each organ offer, the timeline is unique, right? It could take as much as 24 to 48 hours between the first call and the time that the organ is transplanted, right? Or it could be quicker than that. Let's say, the organ has already been offered to different transplant centers and we're one of the bottom ones, and so we don't want that organ sitting for much longer. Then that might be one of those, hey, can you get here in so and so hours, right?
Right.
So it really just depends. So again, each organ is unique, but I can tell you that you'll be given, sufficient time to make your way to the transplant center. In MUSC Charleston right now, we have this guideline that you have to be at least within 9 hours of driving distance to the transplant center for us to say, okay, it's logistically possible for you to make that timeline for your organ offer. If you're
Right.
living further away from that, we do tell you of the challenge why we advise what we advise, because then you might miss out on crucial organ offers, right? So,
Right.
and again, these are things that are discussed with each individual patient by our social worker, because then they work on that. Like, okay, if an organ offer comes along, who are your support people, right? Who are you leaving behind in your house? Do you have children? Do you have pets?
Yes.
Will you have pocket money to, come down to Charleston, right? All of these things get scrutinized. Will you have gas money? Do you have your car, and is it in workable condition? If you have to take a flight, do you have a plan for that too? So all of these things get discussed way ahead of time, and that's fully scrutinized by our social worker, because they're the ones who really help plan with the patient. Like, what are these practical logistical things that you need to anticipate should you then get an organ offer?
Yes. And I just want to say to our viewers and listeners out there seeking a kidney transplant, um, as Dr. Salas stated, she said, yeah, there's a few things going on in the background. Yeah, she's saying, okay, don't drop everything yet. You do have time, but I'll even suggest, because I can say it from a space, don't drag your feet either.
No, don't drag your feet.
Don't drag your feet. Again, planning is the key, folks.
Planning is the key.
Having those pieces in place, especially if you have a family, if you have children, if you have pets, your fur babies, having a workable car. I'll give an example. I had two vehicles at the time when I received the call. One of the vehicles I preferred, which was a SUV, I preferred to take to Charleston when I received the call. But I hadn't got the oil change yet. And I knew that we would be in Charleston for a few weeks. So I had to take my smaller vehicle with me, which was okay. It worked out fine. I would prefer the SUV, but that's another thing, get prepared. Get prepared. That's an interesting point, and I'm glad you brought that up. Like intricate details matter. I even informed my neighbors that, hey guys, I can receive a call at any time. My neighbors knew that I was on dialysis and I was seeking a kidney transplant. And I told them, I said, hey, anytime I could get a call and I may need your help. Are you willing to help? So speak to your neighbor, because while you're away, getting this blessing of a transplant, the trash schedule still happens. Right? And you have to put the garbage can to the curb so they can pick up the trash. And so intricate details, they mean a lot, when you're seeking after a transplant. And we could help you out with that, putting a list together. To Get in Position Foundation, it's been scrolling at the bottom of your screen, folks, how to contact us. And if you're listening, at the end of this, we'll give you our contact information so we could help you guys prepare as well. Dr. Salas, you've been great. I know it's about that time, and you got to go help some other people. But in closing, as it relates to the whole entire evaluation process as a whole, what would you say to those who are seeking transplant, who are currently evaluating wherever they may be? What are the key things that you want them to leave or walk away with from this podcast?
I think the biggest thing is patience, right? A lot of patients get frustrated very quickly. They feel that every requirement from their transplant center is a barrier. They feel that it's taking forever to get on the list. They feel that it's such a long process to get there. And it could be, it might feel like that. But I say patience, resilience, and just perseverance, right? Because again, your transplant centers, your transplant physicians would not ask you for things that are not important for your success. So think of it always that it's because of you. It's not because we just want to demand things from you. No, that's not our job. Our job is to see you through a successful kidney transplant. And because of the process that goes along with it, yes, it could sometimes take quite a bit of patience, perseverance, right? Organization, even to really, get through the pre transplant evaluation. But I say stick through it, see through it, don't give up. Don't feel that, okay, it's just one barrier after another and I'm not getting listed. See it through. And of course, you always have your transplant center liaison, your coordinator who's there to help guide you every step of the process. So use their resources, use the transplant center resources so that you can get through your pre-transplant evaluation. Don't give up, because you're investing on your success. You're investing in a life-changing event where you could potentially be coming off of dialysis or avoiding dialysis for that matter, and coming into a life of being a transplant recipient. That's pretty big, right?
Yes.
And with going through a life-changing event, you do all the necessary preparation. You're not haphazardly doing things. You are very careful. You are very methodical. You are very logical. And yes, it takes somebody to be patient and um, persevering to see it through. But again, I've seen thousands of patients be successful in this. So if those patients are successful, you can be successful too. Talking with people who've already gone through the process, having mentors who are on, we're on the same boat, is always key to better understand the perspective of a patient, right? Okay, what did you go through? How did you prepare? What can I do for myself? So these are just some of the things. So that's my main message, is just be patient. Don't give up. Don't give up. And there's always help to, that is available for you.
Great. Thank you so much, Dr. Salas. Also, thank you so much to the MUSC team. There's so many other individuals who work so hard behind the scenes to ensure that these evaluations go well. There's people on the administrative team. There's nurse practitioners, nurses assistants, physician assistants. The list goes on and on and on to ensure that patients like myself have success early on and also on the other side of transplant. So, Dr. Salas, again, thank you so much for your time, which is one of your most valuable assets. We don't take it for granted here on the Kidney Korner Podcast. And we hope to see you soon. Maybe we can talk about some donor stuff on the donor side, which we need to talk more about because those kidneys are so scarce and there's not enough of them to go around. So we'll talk about that. So Dr. Salas, I'm gonna send you backstage. Just hang out for just a second while I close the show. Thank you so much.
It was a pleasure. It was my privilege to be in your podcast.
Awesome. Take care. Well, folks, you heard it from one of our healthcare professionals. I had a great time. I learned a lot. I thought I knew what I knew. Maybe that's all that I knew. and now I learned even more. So I hope you have. Again, our information has been scrolling at the bottom of the screen. And those who have been listening on the Apple Podcast app, you can contact us at info@getinposition21.org or visit our website at www.getinposition21.org. Make sure you share this link on our YouTube channel. Encourage someone to subscribe. And as always, make sure you get in position as it relates to your health. We'll see you guys soon. Take care.